Good day, class. From this video, we are going to study the sixth meridian differentiation. The terms of the sixth meridian differentiation and central differentiation of the six meridians are exactly the same, just from different translations. This differentiation method was first recorded in 伤寒杂病论, one of the classic. This classics was written in 159 AD to 220 AD. So that's the period of the author. Initially, this book talked about the cold-induced disease. So the diseases in this books were mostly due to cold attack. So some scholars believed that because 1,800 years ago, when it was in 220 AD, the climate was colder than now. So that is one of the possible reasons why the author talk about cold-induced diseases. This is also reasonable because, as we can see now, the climate become warmer and warmer. So this situation might not from recent decades. It might be from the past until now. So 1,800 years ago, the climate might be much colder than now. That's why the patient may suffer from coldness more. So in this book, the author talk about the cold-induced diseases. The six meridians are 太阳 meridian, 阳明 meridian, 少阳 meridian, 太阴 meridian, 少阴 meridian, 厥阴 meridian. Until now, we should feel familiar with the terms. These terms are from yin and yang. Yang and yin. And then from yin and yang, we still going to divide into 太阳, 阳明, 少阳, according to the volume of yang, how much yang they have. 太阴, 少阴, 厥阴, we also going to according to the volume of yin the meridian has. So that's the yang meridian, that's the yin meridian. Also the yang center and yin center. The yin and yang also can represent superficial and internal. So the three yang centers are more superficial compared with the yin centers. So one is these three are superficial, these three are internal. That's from the 8 principles. This differentiation method is one of the most important differentiation methods in Chinese medicine theory, but we are not going to focus on this differentiation method. The reason is because the sixth meridian differentiation more widely used in herbal medicine. How useful this differentiation meridian is from the phenomenon that we can see, not even nowadays, even from the past, as we can see, many practitioners, they only used the sixth meridian differentiation method to analyze all kinds of clinical manifestations. They only use this method, they only use the treatment, the formulas from this book according to the six meridians to see all kinds of diseases, and most of the time they got quite good results. So that's how important this differentiation method is. But the 6 meridians differentiation method is not something we're going to focus on acupuncture study. The reason is because this meridian differentiation method is very important, but it's more important to the herbal medicine. As in the meantime, since it's more for the herbal medicine, why we need to study? That's because the 6 meridian differentiation method, if you know them, it can benefit your future practice. For instance, a patient comes to you with fatigue, cold limbs, cold hands, cold feet, and feel tired. From the 6 meridian differentiation method, we knew that this kinds of manifestations were from Shaoyin disease or Shaoyin syndrome. Shaoyin syndrome is due to the coldness goes into the internal. So that's it from other words. In other words, this is from the internal coldness. We can use herbal medicine to treat. We also can use acupuncture, especially for us. We study acupuncture and know if you knew that this is a Shaoyin syndrome. This is due to the internal coldness. So we can use acupuncture. In future, we're going to study the manipulation method of the acupuncture, how to create heat from the needle. We also can use massage, which also can create heat. So for cold syndrome, for a Shaoyin syndrome, if you diagnose a patient with a Shaoyin syndrome, then we can use the needle or the massage, even with the other method, which can create the heat to benefit the patient. So that's why we're going to study the 6th meridian. And also, when we study about the 6th meridian, it will be a bit different from the Zangfu organs. Until now, we have studied, from the general introduction, we have introduced that we're going to study all of these differentiation methods. Until today, we have studied the previous 4 methods from the 8 principles. We will know where the diseases are, exterior or interior, coldness or heat. And then from the qi, blood and body fluid, we can understand that which aspect has been affected, the qi, blood, or both of the qi and blood. For the etiological factors, we also can identify what are the causes, what are the possible causes. And then from the Zangfu organs, we can identify the location where the diseases are, such as in the liver, in the lungs, in the kidneys. So that's from the Zangfu organs. So as you can see, these 4 diagnostic methods, in most of the time, we actually combine them together because these different methods, they help us to understand the disease from different aspects. These 4 diagnostic methods were from 黄帝内经, so that's the first classic. The 6th meridian is from 伤寒杂病论, that's the development from 黄帝内经 to 伤寒杂病论. 黄帝内经 was about 2,500 years ago. 伤寒杂病论 is about 1,800 years ago. So from these 600s, Chinese medicine theories have improved significantly. A new theory was introduced. And then for the 4 levels and 三焦 meridian, the four levels and the Sanjiao differentiation. These two were developed in the 17th century. That's due to the epidemics in China in 16th century, 17th century. We got a lot of pandemic in China, so the practitioners developed another theory to analyze the pandemic. We also call the worm diseases. The worm diseases, the reason why we also separate these 6 meridian and 4 levels. The reason is from the previous slides we have introduced that the 6 meridian differentiation. Initially, it was developed for the cold-induced diseases, and then the 4 levels and Sanjiao differentiation. These two were developed for the heat or fire-induced syndromes. So these two are one of the most different aspects. One is for the cold-induced diseases, one is mostly from the heat-induced diseases. That's also in the clinics. How do you choose which one do you want to use? This is also one of the clue which one you can use. From the preface of the class 伤寒杂病论, the classic where the 6th meridian comes from, the author Zhang Zhongqing, he introduced that in his family, he was from a very big family, more than 200 people in the family. Within 10 years, more than 2/3 of the family members passed away, and most of them, more than 70% of the family members who has passed away was passed away due to the cold-induced diseases. So he felt that this disease kills a lot of people, and at that time there were no very effective treatment methods. That's why the author studied the old books. And also, the other reason is from the practitioners. At that time, also in the prefix, the author described that many practitioners at that time were very careless. How do we know they were very careless? That's because they don't study the classics. When they diagnose, when they take the pulse, they don't feel 3 regions. When they take the pulse, they also feel the pulse less than 50 beats, which means very quick. So, in other words, nowadays, when we take the pulse, we have to take the pulse more than 1 minute on each hand, or more than 60 beats on each hand. So these are some of the reasons, why the author want to write a new book. How he wrote this new books is not from something he created. He studied the old books, including Huangdi Neijing, and also he studied some other old medical books that we don't have now, we don't see now, but from the prefix we knew the names of the books. These books unfortunately were lost. So these were the backgrounds of the 6th meridian. The 6th meridian is the cold induced. The cold induced, we're going to separate. We're going to separate the yin and yang from here. So yang, this is the yang, 太阳, yang min, 少阳. These are all yang. So they got their surname as yang. 太阴, 少阴, 厥阴, they share the same surname of yin. From yin and yang, we knew that one is internal, one is superficial, or one is exterior, one is interior. So this differentiation method, we don't care about the internal organs. We study the same human body, but we see the human body from the other way. So we're going to think about from the superficial to internal. To the center of the body, we're going to think about there are 6 levels. From superficial of the body to the center of the body, we have 6 levels. And then when the diseases attack us, the diseases, the pathogens, will attack the superficial skin to the superficial level. The superficial level, we name the superficial level as 太阳. We name the deeper level 阳明, and then the even more interior as 少阳. And then the diseases keep developing, go to 太阴, 少阴, 厥阴. From 太阳 to 厥阴, from 太阳 to 厥阴, it is from the exterior to interior. The disease develops deeper and deeper. So you will know that if you see a patient from 太阳 syndrome, manifestations of 太阳 syndrome, and then after a few days, you see the patient manifests as 厥阴 syndrome, you will know that the disease becomes worse because the disease develops from the superficial to internal. The disease, if you see on the other way, reverse, then you can predict that this disease is recovering. So from the 6 meridians, we're going to see the human body from the other way. And sometimes you might be confused. How can we see the human body from the other way? Which one is better or which one is true? That's one of the most common questions that's from students. Which one do you prefer? Which one do you use? Why you need to study this? When I heard of these questions, I will give them the examples. As these examples we have actually shared before. That's if I want to know you, if I want to get to know you, how do I know you? So firstly, I will know that you are a male or female. That's from the gender, right? But if I want to know your personalities, when you are in school, you are a student. So I want to see how hard you studied. Did you write your assignment well? Did you write the test well? And then, did you pass the module? Did you pass the exams? That's all what I need to know you from as a student's part, because as a student, your main job is to study, to pass the exam, to acquire the new knowledge. That's good students in the school can be a very bad person in the society. A very bad person in the school. When I say bad, it's not it's with the bad with quotation. With the quotation marks, it refers to someone didn't study well or didn't get very good marks from the test. A person got very low marks from the test. He can be a very good person in a society. So in order to know you well, not only from your marks, I also need to see from your behavior in the school and out of the school. Your behaviors in your families, your behaviors in front of strangers. So these are from different aspects to study you as a person. But as you can see now, I talk about the marks in your assignments. I talk about the marks in your test. These two are quite similar. But then I mentioned that's the behavior, how you behave when you go home, how you behave in the society. The marks and the behavior, there's no links in between. That's why now we study the 6 meridians, the 8 principles, the 脏腑 organs. They might or might not have connections. This is just we see the human body in a different way. Also in future, when we study the 4 levels, we're going to from here the 太阳 to 厥阴. We separate the human body into 2 big levels, yang and yin. Yang and yin. In yang, we're going to separate 3. 太阳, yang means 少阳, 太阴, 少阴, 厥阴. And then in future, when we study the 4 levels, we're going to separate the human body again in the other way. We're going to separate the human body also from qi, from 2, qi and blood. As you can see, these are also very similar. Qi, also yang, blood is yin. In qi, we're going to separate into 2. In blood, we're also going to separate into 2. So in the 4 levels, we're going to see the human body in these 4 levels: Wei, Qi, Yin nutrition, and blood levels. In Sanjiao differentiation, we're going to study the human body, we're going to separate them into 3 levels. The diseases goes from the upper jiao, it can transfer into middle jiao, can transfer into lower jiao. So that's from different aspects to see the human body, to see the diseases. So don't be confused when you study. And after you study these 3 differentiation methods, you will understand that these 3 and the previous 4, they also connected. There's one patient, 26-year-old male, inhibited urination for 5 days. The patient caught a cold 1 week ago, manifests as aversion to cold and fever. Inhibited urination. Fullness of the lower abdomen, thirsty with desire of water. White, greasy tongue coating, floating pulse. There's another patient, 31-year-old female, chronic diarrhea for 4 weeks. Aggravated, become worse for 2 days because of the cold food. Fullness of abdomen, poor appetite, accent of thirsty, abdominal pain, prefer warmth. Pale tongue with white, greasy coating and weak pulse. So in these 2 patients, when these 2 patients came to you, you can think about how to analyze You can either analyze from the Zangfu organs, and then when we study the 6 meridians, you will see we also can analyze from the 6 meridians. We're going to study in the next, we're going to introduce the details in the next video, and at the end, we're going to analyze these 2 cases. Thank you for your attention. And in the meantime, you can just think about how to analyze.